Hello and welcome. Today we're going to explore a widely used and incredibly helpful tool in mental health, the Generalized Anxiety Disorder 7, or as it's more commonly known, the GAD-7. This assessment was developed by DRs Robert Spitzer, Janet Williams, Kurt Kroenke, and their colleagues, with support from an educational grant from Pfizer. So what exactly is the GAD-7? Recognizing the signs of mental health disorders isn't always easy, which is why streamlined tools are so vital for healthcare professionals. In the mid-1990s, the creators of the GAD-7 developed a comprehensive tool called the PRIME-MD to evaluate various mental disorders in primary care. From this larger project, they created the GAD-7 as a brief, focused scale that measures 7 common symptoms of anxiety. While it was originally designed to help diagnose generalized anxiety disorder, clinicians quickly discovered its value extended far beyond that. It has proven to be a highly sensitive and effective screener for other conditions as well, including panic disorder, social anxiety, and post-traumatic stress disorder. The GAD-7 serves 3 primary and powerful purposes in a clinical setting. First, it acts as an initial screener, helping to identify individuals who may be struggling with various anxiety disorders. Think of it as a first-pass filter that can flag potential issues needing a closer look. Second, beyond just identifying anxiety, it helps us assess the severity of those symptoms. This allows us to understand if the anxiety is mild, moderate, or severe, which is crucial for treatment planning. And finally, the GAD-7 is an excellent tool to monitor a client's progress over time, allowing you to track how symptoms change in response to treatment. One of the biggest strengths of the GAD-7 is its sheer practicality, which becomes clear when we look at how it's administered. It's suitable for individuals aged 14 and above, which makes it a nearly universal screening instrument for adolescents and adults. The assessment is self-administered, meaning the client can complete it on their own, either in your office or remotely. This is incredibly convenient. You can even send it to a client online before their session, which helps you be better prepared from the start. Best of all, it typically takes less than 5 minutes to complete, making it a quick and efficient part of any clinical workflow. Let's take a look at the questionnaire itself. The instructions are simple and direct, asking the individual to reflect on their experiences over the last 2 weeks. It consists of just 7 questions, each targeting a core symptom of anxiety. These questions cover feelings of nervousness, uncontrollable worrying, and trouble relaxing. For each item, the person rates how often they've been bothered by the problem using a 4-point Likert scale, ranging from not at all to nearly every day. Once the questionnaire is completed, scoring is incredibly straightforward. Each response is assigned a numerical value. Not at all is 0, several days is 1, more than half the days is 2, and nearly every day is 3. We simply add up the scores for all 7 items to get a total score, which can range from 0 to 21. This total score then helps us understand the level of anxiety, with cutoff points for mild, moderate, and severe categories. Scores of 5, 10, and 15 are used as the respective cutoffs. As a general rule for screening, a score of 10 or greater is often a recommended threshold to prompt further evaluation for an anxiety disorder. Of course, a score on a questionnaire is just one piece of the puzzle. After using the GAD-7 to get a provisional idea of the client's anxiety level, it's essential to consider the broader clinical context. We need to ask questions to understand the full story. For instance, are the current symptoms linked to any specific psychosocial stressors? It's also important to understand the duration of the symptoms and how much they are impairing the person's work and daily activities. Finally, exploring any personal history or family history of similar conditions can provide valuable insights that will inform management and treatment decisions. While the GAD-7 is simple on its own, a platform like PsyPack can make the entire process of administration, scoring, and tracking even easier. You can initiate an assessment online with just a few clicks, sending a link directly to your client to complete in the office or at home. Because the GAD-7 is so sensitive to change, PsyPack allows you to easily schedule the assessment to repeat at fixed intervals. This makes it effortless to monitor treatment response over time. As soon as the client finishes, a comprehensive report is generated automatically, saving you valuable time. Let's take a closer look at the kind of reports PsyPack generates. It provides automatic scoring and an interpretive report complete with color-coded graphs and tables, which takes care of all the complexity for you. This frees you up to spend time where it matters most, with your client. You get a color-coded graph of the individual responses, which helps you quickly identify the most pressing symptoms at a glance. The report also shows the total score and its corresponding severity level, plotted on a clear, color-coded graph for intuitive and fast interpretation. Perhaps one of the most powerful features for ongoing care is the ability to track progress visually over time. When you administer the GAD-7 multiple times, PsyPack automatically plots the scores on a progress graph. This means you don't have to sift through previous reports to see how a client is doing. With just a single glance, you can clearly see the trajectory of their symptoms and track their response to treatment, making it easy to see if a client is moving from a moderate to a mild level of anxiety, for example. To explore how you can streamline your assessment process with tools like the GAD-7, we invite you to create a free account on PsyPack.com. Follow us to stay ahead with the latest in psychological assessments and tools. Thank you for your time and attention.